Good afternoon, ladies and gentlemen, and welcome to our long-awaited webinar. This is the COWHA webinar, the first in our 3 webinar series, which will be running for the next half of the year. My name is Regan Andera. I'm the project associate at Africa Health Business, which is the secretariat for the Coalition for Women's Health in Africa. And I'm so honored to invite you all, esteemed panelists and all the attendees from across Africa and globally in this webinar, which seeks to explore the role of partnerships in driving access to women's health, access to women's reproductive health in Africa. Feel welcome, and let's continue together to the end so that we can discuss how best to advance women's health. So just to start, allow me to take you through some housekeeping rules for this webinar. And one, it's good to know that we hope to record this webinar. So we are making a humble request that you allow us to record this webinar. We are seeking your consent that we record this webinar for future reference. Also, we are requesting that the attendees for this webinar should turn off or mute their microphones so that we minimize on possible interruptions during the session. Thirdly, we are requesting that all participants should feel free to share any thoughts, any comments, and any questions on the chat section so that we will refer to them and make any possible give answers or input to what will be shared. So just allow me also to briefly share the program for this webinar. So right now, what's happening is the opening and introduction, after which we will have a keynote address, followed by a panel discussion that will last for 1 hour, after which we will have an open forum to just engage in answering questions that might arise from the discussion. Then we'll have some closing remarks. So at this point, please allow me to share a bit about our coalition so that we can continue. The Coalition for Women's Health in Africa is a private unified platform for private sector stakeholders joining forces to create an Africa enabling environment for women's health across Africa. So our coalition originated from a collective vision that arose from the first Africa Women's Health Symposium that was curated by Africa Health Business in 2022. And since then, we've been working to unite different stakeholders, private sector stakeholders, to advance women's health. And this is what is bringing us together even today, just to continue the discussion on advancing women's health. So a bit about how we work. Our coalition works collaborative approach, which puts in place, brings in place different players in the SRH space, in the cancer space, in the maternal and newborn health space, just to advance the conversation on women's health. We have focus areas which I've just mentioned. Then apart from that, we also have focus countries. In as much as we want to shed to advance women's health across Africa, we have focus countries for now, and we are doing that in Kenya, Ghana, and South Africa, being guided by the pillars of knowledge and research, awareness, policy, and dialogue, as well as action. So at this point, please allow me to once again invite you all to this webinar discussion, and now hand over the program to our very able moderator, Dr. Gathari Ndirangu, who will be running the session from here. Thank you very much, and welcome, Dr. Gathari.
Thank you, Regan, and greetings, everyone. We are really excited and delighted to have you on this webinar. As Regan has mentioned, my name is Gathari Dirango. My background is obstetrics gynecology, serving as a chair of the COWHA Sexual and Reproductive Health Technical Working Group, but also coming from JPIGO, where I am the Global Family Planning and Reproductive Health Director. We are excited by today's conversation because, as you know, Africa lags behind in terms of accessing women and girls accessing reproductive. In fact, everybody, women, girls, and their families, being able to access sexual and reproductive health services optimally. Yes, we do acknowledge and recognize that progress has been made, but unfortunately, it is still slow. But we want to really, so this panel today will help us, think through how partnerships can be used to accelerate access to this. And we have a rich panel of experts, beginning with our keynote speaker, who I'm going to allow to speak just shortly, Professor Julio Rakotonirina, who is the Director of Health and Humanitarian Affairs at the African Union Commission, African Union Commission in Addis Ababa. Professor Julio is the Director of Health and Humanitarian Affairs at the Commission since October last year. And before that, he was based in Madagascar, where he worked through the health system from PHC. We all recognize the value of primary health care to the director of University Hospital. And in 2019, 2020, he was the Minister for Public Health in Madagascar. He has been a skilled individual for more than 20 years on the African continent, especially those that speak French, I would say, Madagascar, Benin, and Comoros. He's also been an expert consultant, a medical doctor specializing in public health and epidemiology, more specifically where he holds a PhD. He has strong and evolving skills in health system management and epidemic management, and he played a critical role during the COVID pandemic. He's actively involved in international and African multidisciplinary expert networks, including DemoStaff Project, Demography and Statistics for Africa, and Pursuit 2 Project, a partnership to enhance technical support for analytical capacity and data use for malaria, TB, and HIV in Southern and Eastern Africa. Professor, we really are excited and delighted that you are able to join us and give us your keynote address. Over to you, Professor Julio.
Thank you so much, dear colleague. That's only to give more precision. I started at African Union on 2022, not 2023. Just I'd like to acknowledge the importance of the collaboration with the private sector in achieving quality, affordable, and accessible care and services for all women, and emphasize the significance of leaving no one behind, particularly women, mothers, and also children. In alignment, of course, with our continent vision for the Agenda 2063, and even with the SDG documents. And I'd like to thank you so much, especially the COWHA, for bringing such an thankful webinar and under the team today. And first of all, let me reiterate a brief overview of the campaign on accelerated reduction of maternal mortality in Africa, CARMA Plus. which brings the African Union Commission's high-level advocacy efforts on the underlying issues that limit access to reproductive health, and while also it provides a platform of our member states to share lessons learned and share solutions through different partnerships. You know that the COWHA Plus, this campaign was developed by the African Union Commission as a new roadmap for accelerated actions toward the reduction of maternal mortality in Africa, and parallelly developed the accountability partnership framework to strengthen the campaign right after an evaluation conducted in 2019. The evaluation revealed that member states that wholeheartedly embrace the campaign at the highest political levels experienced significant improvement in their reproductive, maternal, newborn, child, and adolescent health indicators. The analysis of the campaign indicates that COWHA remains highly relevant in Africa. Therefore, we developed a new roadmap called COWHA Plus 2021-2030 that prioritizes the unfinished indicators and objectives, especially how to reduce the maternal mortality in Africa. Dear colleagues, given the collaborative nature of COWHA Plus involves partnership with various stakeholders, including African Union regional economic communities, technical experts, financial institutions, governmental agencies, non-governmental organizations, civil society, and the private sector. As I mentioned before, the Commission established an accountability partnership framework to monitor campaign implementation progress and to provide a platform at continental level to also share mutual experiences and endorse decisions regarding the reduction of maternal mortality in Africa. The framework seeks to build on existing structure, partnerships, and events to provide this platform and motivate the reduction of maternal, newborn, child, and adolescent mortality in Africa, with a focus to develop new strategies and plans that to ensure effective coordination and implementation of existing ones. While the responsibility and accountability for implementation and results belong at the country level, with the active engagement of government, RECs, stakeholders, and private sector, play a vital role in investing into reproductive health, the reason why we are here today. Let us remind ourselves that without each of our collective efforts, we cannot reach our goals on reproductive health. So we shall all be involved and be accountable. The African Union framework for partnership, especially partnering with the private sector, is applicable at all country member states in mobilizing financial resources that lead to tangible improvement in healthcare delivery and outcomes on reproductive health. The campaign encourages the private sector at all stages to provide and invest in innovative services. We have put in place a regional award named Mama Africa Award. This is mainly to recognize the good work of different actors, reproductive health, their contributions to progress and key achievements, and impactful metrics of COWHA plus interventions. In implementing the COWHA plus initiatives, funding constraints, logistical challenges, and cultural barriers to healthcare access are supported by the private sector investments. We also emphasize on the potential opportunity for getting innovative technologies and digital solutions to enhance collaboration and improve healthcare delivery outcomes for mothers, newborn, child, and adolescent. Dear colleagues, in conclusion, I wish to call for continued collaboration and partnership between different actors on reproductive health and mainly the private sector to spotlight the remaining problems while providing contextualized solutions. The Commission encourages stakeholders to join forces in advancing the Agenda 2063 and SDG related to maternal and child health, reaffirming the commitment to leaving no one behind in the pursuit of universal health coverage. Thank you.
Thank you so much, Prof. We applaud you, and we really highly appreciate and are grateful that you're able to join us and make those remarks. We really do recognize the value of what you've spoken about, and especially the African Union. You've reminded us of the campaign on accelerated reduction of maternal mortality in Africa. And for us to be able to, to achieve all the SDGs and indeed universal health coverage, we cannot do it. No single sector can do it alone. So the role of bringing government and partners together, the private sector included, as we know, roughly half of people actually do access services through the private sector on this continent. So really applaud you for reminding us that and really setting the background upon which this conversation today will be based. I also love the value that you mentioned, bringing on innovation and especially digital health solutions that we see this continent as the youngest continent on the globe has a lot of potential that we're probably not optimizing. And we hope that really this conversation today will be able to help us get closer to where we need to be. Of course, they are not reminding anyone, the value of family planning, especially in reducing maternal mortality across all age groups. But you also know the value, especially on adolescents and young people. Like you said, it's really a young continent, and we really need to be able to harness and allow the youth to realize their full potential. And family planning, is one, for those who need it, is one of the avenues. Of course, we also do recognize, things like nutrition, immunization, including against HPV. So we all know there are many, many things that we are probably not doing our best to drive. And hopefully this morning or this afternoon, depending on your time zone or evening, we will be able to discuss that. Thank you so much, Professor. Agenda 63 is on our minds. Adolescent and youth health is on our minds. SDGs is on our mind as we have this conversation. Thank you very much.
Thank you, sir.
So without further ado, we are going to get into our panel discussion. And our panelists today are, really highly experienced individuals, and we'll hear some of the things that they have to initiate this conversation today. I have the honor and privilege of introducing our first panelist, who is also the board chair of the Coalition for Women's Health in Africa, and an individual that I have enjoyed working with, Mrs. Mukadi Mashishi, who's the Organon Africa Access Markets Director, and also, like I've said, the chairperson of the Coalition for Women's Health in Africa. And as the Access Markets Director for Africa, she is responsible for business access policy and what Organon calls environmental, social, and governance, which is really tailored for the woman and girl in Africa. She has over 25 years experience in healthcare across the public and private sectors, academia, and the pharmaceutical industry. And as the chair of COWHA, like Regan mentioned earlier, is a private-led group of organizations and companies working towards an enabling environment for women's health on the continent. She serves on the board of directors for Organon South Africa and AmCham South Africa, which is the American Chamber of Commerce for South Africa. She holds a BSc in dietetics, wonderful, from the Medical University of South Africa. It's now known as the Sefako Mokado University. She has a postgraduate diploma in business management from the University of Leeds Business School, and a business leadership program from Duke University. And she is also a professional, has a professional business coaching, and currently studying towards an MSc in Global Health Policy at the London School of Hygiene and Tropical Medicine. Mukadi, I hopefully have made justice about introducing your rich bio. And we will start off, really asking around, what you've seen, as a principal, as Organon, representing Organon, and Organon is a principal founding member of COWHA, which is a coalition for women's health in Africa. Perhaps you could start by telling us what was the vision that pushed the organization and you as an individual to establish this unified platform for private sector players on driving equity in women's health, instead of competing for market share, really looking forward clearances around that. The reasoning and the visioning around setting up the coalition. Over to you, Mokadi. Thank you.
Thank you so much, Dr. Gathari, for that very generous introduction, and good afternoon and good morning, esteemed ladies and gentlemen. It gives me a great pleasure to really be part of this esteemed panel. So we launched Organon in June 2021, and yes, it was in the middle of the pandemic. But when we launched the organization, we felt that we're launching more than just a company. We're actually launching a commitment to women, a commitment to her, and our mission is actually, a better. We aspire to get to a world where, the world is a better and a healthier place for women. So our mission is a better and healthier every day for every woman. And I dare to add, from wherever they are based. And the reality is that we as an organization are deeply rooted in the understanding that when women rise, we all rise. We also understand that women are, when they are healthier and they're empowered, so too are their families and their communities. We are committed to advancing gender equity as well as gender equality, because again, in order to achieve a healthier every day for every woman, we have to ensure that women are also present in the right spaces, right? So when we launched the organization, in line with our mission, we ensured that we had 70% representation in our senior leadership team. And most recently, actually as early as the 1st of July this year, we have actually launched a new cluster where we will be servicing Middle East, Turkey, and Africa. And we're launching this with 50-50 representation across our workforce in terms of women and men. And one would appreciate that across the continent and within these particular countries that I've mentioned that form part of the so-called emerging markets in pharma language, the representation of women has always been a very low, So to see that as an organization, we are mirroring the 50% representation from a global population perspective, right? And some of the key statistics that are at the core of what drives us and ultimately why it was important for Organon to be part of or to formulate the Coalition for Women's Health in Africa was that if you look at some of the key statistics, over 70% of maternal deaths that occur globally occur on the African continent. And these are preventable things. And it's good to hear from Prof. Julio that we have made progress in terms of, each country working towards achieving reduction in maternal deaths. While we have made progress, there is still a long way to go. And then if we shift the focus and we look at the unmet need for contraception on the continent, over 54 million women and girls in Africa do not have access to contraception if they wish to actually have that. And then if we look at unintended pregnancy, in some countries, the rate of unintended pregnancy is as high as 65% among women on the continent. And the reality is that we need to get to a point where society also accepts and acknowledges that women have the right to choose when to have children, if they want to have children, and how many children they should have. And that is why, as much as the coalition is focused on women's health and Organon is focused on women's health, men are critical stakeholders in this particular conversation as well. And then if we shift our focus to the breast cancer, cervical cancer, and the other sexual and reproductive health cancers, one can also appreciate that African women still bear the highest burden of mortality due to these cancers, and mainly because these are generally detected much later in life. And if we can get more involved in early screening, this will definitely serve well for for women. And across the continent as well, one can appreciate that the representation of women in leadership role in healthcare is still extremely low. And we need to work towards that, empowering more women to take on the task. Some of them are leading women's health, but from the back, not necessarily in formal leadership roles. So we need to acknowledge these women, and we need to actually provide platforms where they can actually actively visibly participate in changing this. And if we look at the some of the core things that would help us to achieve this, really working together is one of those. And that really is at the heart of why we started the Coalition for Women's Health, why it was formulated. The intention is for all of us to unite for women's health in Africa and unite for her, because there is so much power in unity. And one can just imagine the impact that we will have if we are all working towards the same goal together. And I think if we think about it, there is many different initiatives across the continent which are aimed at improving women's health. Through the coalition, what we are encouraging is that let's actually work together towards that common goal to ensure that our efforts can be exponential. Because I always say, imagine the domino effect that you will have if Organon brings our expertise, Jaipago brings their expertise, the government brings their expertise, the Africa Union brings their expertise, and many other partners. The impact will be so much more. It's like the dominoes. We all know how dominoes operate, right? And I think the appreciation that women are the pillar of society, and if we all work together towards ensuring that we can accelerate access to quality healthcare, which is very close to everyone who is on this call as well, the impact and the meaningful impact that we can have is absolutely incredible. And more importantly, we also need to appreciate that, as Prof. Julio mentioned and also Dr. Gathari mentioned, we need to always be inclusive in the solutions. There is a slogan that I like. I think the youth tend to use it a lot, and we need to ensure that we amplify their voices, but we also amplify the voices of women. And the slogan says, "Nothing for us without us." And this will ensure that we drive the ownership that is required at community level, but along with the political will and the willingness of the private sector to drive the positive impact for women's health. And with COWHA, our intention was also to provide a platform where we can better the lives of all the women in our lives, be it our mothers, our grandmothers, our aunts, our sisters, our daughters, our nieces, all the women in our lives, because when we bring this closer to our personal lives, you tend to get a lot more impact. So women need to have healthcare facilities and services and quality care and products that ensure that they are well taken care of. They need to be in spaces where they feel safe, where they feel seen, where they feel heard and understood, as well as respected, because there is so much power in that. And for Organon, our feeling was that the impact of COWHA should really be felt long after all of us are gone. It really has to be a legacy for those that come after us. Just like all the other our forefathers who have fought so hard for all of us to enjoy the benefits that we enjoy today. COWHA is really intended to have a similar impact in the healthcare space, particularly for women. And I'm very encouraged by the work that we have been able to achieve in the last year and a half since we launched, that has actually been so incredible to see the number of partners that have come together and bought into this entire concept. So thank you so much, Dr. Gathari. I will stop here as we continue.
Thank you so much, Madam Chair. We for your insightful, inputs, and we look forward to continued engagement. Thank you for reminding us of the burden of unintended pregnancy on the continent, which, as we do recognize, is one big problem, and of course, limited access to contraceptive services. Thank you too for pointing out the role of women in leadership. We do recognize and acknowledge that, if you do not give opportunities for women to occupy this position, then we will not move as fast as we would want. And of course, reminding us that the sum is greater than the individual parts. So we really appreciate bringing us together, reminding us about the role of partnerships. And as we continue, of course, we'll continue leaning onto you to hear a little more of what you have in mind about the coalition and what we can do together better as a continent to be able to accelerate access. Thank you so much, Madam Chair. So without further ado, I'll introduce our next speaker. Our next speaker is Ms. Angela Nguku. Angela Nguku is the driving force behind the White Ribbon Alliance in Kenya, especially. And she has been championing the quality of our interventions, reproductive, maternal, newborn, child and adolescent health, and nutrition, and also from using the lens of a user, but also representing the communities that are served with this, provided with these services. She's a midwife, by training. She's an advocate and thought leader who has been pushing prioritization of self-articulated needs of women, girls, newborn, and midwives in the settings that we work in that are really significantly under-resourced. She has played a key role in designing and delivering an unprecedented and transformative What Women Want campaign, and I believe JPIGO and Organon are actually part of it. She also plays roles on various committees and boards, including Align MNH, again, that is led by JPIGO, Unifying Midwifery in Africa Steering Committee, Global Action Plan for Healthier Lives and Wellbeing Advisory Group. She's also on the People's Advisory Board of the Lancet Global Health Commission on Quality Health Systems in the SDGs era, and also in the Global Health Council Board, Mark for Mothers Advisory Board, the WHO PPH Steering Committee. She's actually everywhere. The Bridge Commission on Addressing Information Gaps in Women with Chronic Conditions during pregnancy and breastfeeding, and the list goes on and on. Angela, I think you have such a rich bio, and I know you've also really been a huge advocate to make sure that you're listening to women and girls, to people that you're working with. And perhaps in a few minutes, you can just tell us, White Ribbon Alliance. The White Ribbon Alliance has been around for years, been on the front line in amplifying the voices for those are farthest left behind, and how you have been sharing stories from the grassroots, especially on women's reproductive health. Perhaps you could use this opportunity to sort of give us a glimpse of the challenges women go through in terms of accessing care across the continent, or you can use whatever country as an example, and what you see as gaps that you can highlight for us. And then, of course, we'll be thinking that potentially this would be opportunities for us to consider. And then also, perhaps also try as much as you can. I know you are on the ground, all these things that, what are some of the causes of these gaps? And maybe then, again, that laying the foundation upon which you should be really reflecting on as we try to tackle the challenges that women have in accessing reproductive health services. Over to you, Angela.
Thank you so much, Gathari, and it's really a pleasure to to be here and really to just share some of the insights from the work that I do. I think you've mentioned a lot about White Ribbon Alliance, and White Ribbon Alliance, for those who do not know, we are a people-led movement for reproductive, maternal, newborn health, adolescent rights and gender justice. But we've just, given the nature of our work, we've just done a big strategic shift moving forward. So we will be looking at the broader women's health, because we no longer want to be siloing women again around their reproductive health needs alone. And as such, our work is really driven by the self-articulated needs. We start and we keep on advancing the advocacy around ensuring that whatever we do, whether it's in programming, policy decisions, resourcing, whether it's in whatever aspect that we are doing, whether it is in service delivery, this is driven, the foundation of everything that we do is actually driven by the self-articulated needs of the users. We call the users in White Ribbon Alliance the real experts. And if you know, you and me, we've been in practice for quite a long time, whether in our different angles. The users of care who form the majority, almost 90% of the players in the space, in the system, are actually left out in everything that we do. So their voices, they have been passive recipients of care rather than active architects of the same healthcare that they are supposed to be receiving. And as such, White Ribbon Alliance across board, this is our 25th year really as a White Ribbon Alliance movement, but in Kenya, we've been here for the last 6 years or more. Let me say that. We acknowledge that women are not homogeneous, one, and that women are not just, should not just be passive recipients of care. They should be active drivers. As we all know that at the end of the day, the wearer of the shoe is the one that knows where it pinches most. So even as much as possible as we are making the products, as much as we are making we are doing the research, as much as we are doing the practice, we cannot hold ourselves accountable. We need to be told whether we are giving, is it quality, is it dignified, is it equitable, and the like. And as such, for the longest time, we keep on ensuring, or we keep on pushing everybody, every player that is addressing and advancing women and girls' issues and the communities in general should start from the place of what exactly is the need. Because there's a lot of plug and play narrative that goes on where we assume we know the need. And so we sit and craft all these needs for women in our offices, in our boardrooms, in our conferences, and in many, even in our research papers, which are very academically driven. And as such, as White Ribbon Alliance, we challenge that narrative and start by telling people that at the end of the day, I think it's important that we know what exactly is the need. It's like someone coming to your house and telling you that I know you are hungry and I think you need bread. And maybe you are not even a consumer of bread at the end of the day. And at the same time, the blanket, we also challenge the blanketness of the solutions that we offer. And that's why I started by saying that women and girls are are not homogeneous. And as such, we acknowledge that there are women living in rural areas. There are nomadic women. There are women coming from different backgrounds. We have those who are living disability. We have women and girls who are living in the informal settlements. And we have the easy to reach women that majority of the work that we do in the programming and development space, for example, and also within our sectors, the public and the private sector, we go to the easy to reach, but we have women from all walks of life. We challenge that and tell people that at the end of the day, we need to be able to invest to address the needs of all these women in all the different angles and the like. And so as I address the question that you've asked me, I'll start by addressing this from 4 areas, a framework that we've come up with as White Ribbon Alliance through the approach that we use, the ask, listen, act approach, because we challenge the narrative that has been existing for a long time that we need to design for them, and challenge that and say we need to start by asking them what exactly are their needs. We need to, after we ask, we need to sit and listen to them. We prioritize with them as they tell us what are these needs, how do they come in order of priority, and at the end of the day, we need to act with them. A lot of times we act for them, and no wonder our programs are not sustainable. No wonder how we do our things. No wonder our products don't go far. We keep on marketing. We keep on doing so much. No wonder a lot of the interventions are not long lasting, because at the end of the day, we do it for them instead of doing it with them so that they own it and then they drive the agenda at the end of the day. And so the framework through the work that we do and through the foundation of the work that we do, which is the What Women Want campaign, which we began in 2018, and we has formed the basis of the work that we do across board, that we don't start any projects any work without listening to the needs of women. And we don't just listen, ask and listen, we act. And we have a framework that we've developed to showcase how that needs to look like, even for every player. And I'm glad today we are talking about partnerships, because this framework actually addresses these partnerships. And I will tell you the challenges where. Why? One, this framework starts by looking at the people. I call it the 4Ps framework, which is now rooted on two things: to research and innovation, which becomes a benchmark of what we do at the end of the day. The people, the users of care, the real experts of care, what I call the real experts of care, they must be part and parcel of these partnerships. We cannot do it having them as passive recipients. We have to continue pushing that at the end of the day that they become active players, because they are important and they are the ones to tell us this is needed or not needed. Then, excuse me, then the other bit of it is the practice. The health workers, the providers, they need to be part and parcel of this. They cannot be left out. They're the ones who are going to offer care. They're the ones who are in the villages. They are the ones who are in the health facilities, but also they're the ones who are sitting to make decisions. More to that, we look at the policy making, the policy and the resourcing bit of it. They also need to be part and parcel of these partnerships, and they need to start all this from the listening, from exactly what are the needs before we can even do anything. And even the products, manufacturers, whether it's a public or the private sector, comes in there. What exactly are you manufacturing? What exactly is diagnostics? What exactly are they meeting the needs of these people? So we start with the people, and then everything else then comes around that. So that framework should be all rounded. It cannot miss out on one area. But underlying that, of course, we acknowledge the place of research and innovation. This has to be continuous across board. How do we ensure that all this is really embedded? And to come to your question, Dr. Gadari, I think one of the things that has been the main challenge that we are seeing as White Ribbon Alliance in the work that we've done, not just in Kenya, but across Africa and Asia, where we are majorly represented, is that the key thing that has really made us not achieve what we want to achieve is, one, failing to acknowledge that we have the same agenda across board, that what we want to see, whether it is the user of care, the people themselves, the women themselves, and the provider of care, whether it's the manufacturers, the product deliverers, whether it is the providers of care, whether there is the researchers, whether they are the policy makers, the resource makers, and the decision makers, and the like, that we all are geared towards seeing better health outcomes for women and girls. We fail to acknowledge that the users of care and the providers of care have this common goal. And until we can be able to acknowledge that common goal, that at the end of the day, we are all geared towards this one agenda, we'll continue competing instead of collaborating. And the other challenge that really comes with that is that we have decided that the recipients of care should be sidelined and siloed, and their voices are silent. So we have sidelined the users of care and assume that they don't know. So they are not supposed to be partners, part of the partners. We should come to them and tell them this. No wonder we don't go far. And I keep saying that in every space, because until we understand that you might be providing a product that is not needed in that place, or you might be providing a product that is actually not culturally accepted in that place, or you could actually be doing something that's already been done by someone else. So if you start by going to ask the people, the users, what exactly is the issue, they will actually tell you this was done and it didn't work. So we are wasting resources by replicating the same things that have not worked for these communities, or they are not needed in the first place. The second challenge that I see, and we've seen across board in our work as White Ribbon Alliance, is that we have assumed that at the end of the day, the women and girls must be siloed. So we come with family planning, and we address family planning, and we'll run with it. And we make everything about family planning. Then we come and decide it's pregnancy, it's A and C, and we run with it. And then we come here and decide it's cervical cancer, we run with it. So we have siloed this woman instead of integrating the different pieces of this woman together for us to be able to get it right. And by doing that, we save on resources, we save on time, but we address what is really needed. The other thing that I think we have really done, and which we've really come to acknowledge from the What Women Want campaign, listening to women and just asking across the different spaces, and let me just talk this across, especially in the African region, is that we address women issues as just health issues. Let me make you let me paint a picture here. When we did the original What Women Want campaign, and even when we've done the health and well-being campaign, when we've gone to ask women, what do your newborns want? What does dignity mean for you? What does quality paint for us? What quality means? Quality for women brought in the issues about climate change. Quality for women brought out the issues about the economic power. Quality for women brought out the issues around how they are treated in the health facilities, their decision-making power in the households. It brought out about the transport networks, the security and the agriculture, water, sanitation, and hygiene, and so many things that we normally program our work, policy make without all these social determinants in mind. And if we can be able to come back again and ask ourselves, if we only looked at women from the place of starting to ask a woman, we will not be just pushing so much money into one area like the health facility, forgetting that the other social determinants that actually determine whether that woman is going to achieve or access that care, whether it's going to be quality, whether it's accessible in the socioeconomic aspect of it, the economic aspect of it, the cultural aspect of it, from a climatic aspect of it, from so many aspects of it. And that is why we've gone further to even understand more. And we've done asked different questions to women across board in all their diversity, then define for us, what is the impact, for example, of climate change? What is the impact of cost of living? What we are calling the 4Cs report that we are just about to launch, that was done towards the end of last year. What is the impact of the cost of living, for example, the conflict where you live? Issues that are really outside the health sector, but we have continued looking at these issues as these health sector issues. That way, we've not been able to achieve so much more. And as I conclude, I think one of the other things that we really need to think about is the competition vis-a-vis collaboration. That has also been a big deal. We are so much into our egos and logos and visibility of how our logo looks like, how our ego, and who says that I'm the one who wants this. We forgot that at the end of the day, our mainstay, our business should be women and girls' health. And so we are so much into the whole aspect of who has done the best. We are so much in competition vis-a-vis collaboration that we have forgotten what exactly are we doing? Where are we in this space? Yet women are telling us, all we need is my newborn to have immunization. All I need is for me to get the HPV vaccine. All I need is for me to be able to access that health facility on time, to have the right information, and so on and so forth. And so the work that we do at White Ribbon Alliance is actually to bring all these players together. That's why we are a network of different players, because we realize that it's not just the health sector. It is all these interrelated angles. Instead of saying, let's just deal with the public sector providers, we acknowledge that women go to all sides of health providers. It doesn't matter whether it's public or not. They don't know that. All they care is that they want their health and well-being to be realized. So as I conclude, I think it's important to ask ourselves, who are we doing it for? What are we doing, and how are we going to do it differently? And as we're thinking partnerships, are we just continuing to think in terms of us or them, but also holistically? Who are these other actors across board that we need to bring on the table? Thank you so much, Gadari, and back to everybody. Thank you.
Thank you, Angela. We'll get back to you. You can hear the passion in your voice. We'll get back to you. But thanks for reminding us about very pertinent issues that we really need to center our care on the individual, the user, as you say, the user is the expert of care. Really, really powerful and thought-provoking. Of course, you do remind us again about making sure that there's quality care that you're providing, and it is also given in a respectful and dignified manner. But I do love the ask, listen, act approach, the framework that you did mention, and reminding us again, we are not in competition. We should be complementing each other in whatever we are doing. And if we center our care actually on the individual, we will be able to go very far. I think also reminding us not to slice the woman into small pieces, but think of integrated service delivery models. I think those are powerful. But you're going to get back to you. But right now, allow me to introduce our next speaker, obviously an important speaker in this conversation, representing the government of Kenya through the Ministry of Health, in the name of Mrs. Gladys Mugambi, who is the head of Health Promotion Education at the Directorate of Health Promotion Education at the Ministry of Health that, like I mentioned, I've worked with Gladys for a couple of years and really know she's a very powerful individual who holds a degree in home economics and a Master of Science in Food and Nutrition, currently pursuing a PhD actually in health system management. She has previously worked as a nutritionist in Kenya with the Ministry of Health, both at the national and sub-national levels. She has also been the co-chair of Scaling Up Nutrition Movement Executive Committee. She's also a member of the Health in All Policies Global Executive Committee, and obviously an experience in policy development, implementation, leadership, and management in health and nutrition, advocacy, behavior, social behavior, communication, and gender mainstreaming. Gladys, we are delighted to have you on this panel and really looking forward to your thoughts, especially as you've been talking about really partnerships and making sure that we are centering whatever you're doing on the individual. So really, in your experience, what do you see as some of the key challenges that governments on this continent face in ensuring widespread access to comprehensive RH services? And also, how do you think partnerships could help address these challenges, from your perspective, especially representing the government? Over to you, Gladys. Thank you.
Thank you very much, Dr. Gathari, for introducing me and for the invitation to this important webinar. And as I represent government, you all know that government is responsible for the people. We take leadership in terms of ensuring that there are policies and policies are being implemented. But when we come to discuss about women's health, women face a lot of challenges, and women require health services that are of high quality. And these services are expected to be everywhere. And that means that they should all access those services. And as you had said earlier, some of the services that we look at when we talk about women are the maternity services, services to good nutrition at household level, access to contraceptives, access to immunization, issues of the challenges that women face, like the issue of fistula and issues of preeclampsia that are being raised. And we are aware that partnership plays a big role. And as government, we have challenges that we may not be able to handle alone, and that is why we need partnerships. So most of the times the government does not have adequate resources, and the resources as they are being allocated, even to health, there are many other health issues that need to be dealt with, not just issues that have to do with the women and reproductive health. So the resources are always inadequate, and when we talk of resources, it's both financial and the capacities for human resource to be able to deal with the several issues that we have. Given that I lead the docket of health promotion, the issue of promoting what the women require, promoting the products, empowering them so that they are able to deal with these issues actually falls on my docket. And that is an area that we found that is not well addressed. And most of the times we tend to focus on communication through media and forget to engage women directly so that we can understand their problems. So there are problems in terms of information. It's a challenge. Some women do not know what to do in the various situations they find themselves in. And therefore, that becomes a challenge, because if they're not well empowered, then they are not able to deal with their issues themselves. They will always depend on somebody else to give them the support. Now, there is a low focus on demand generation so that they know what to look for and what to ask for. The issue of collaboration with other ministries is also key because, for example, if we want to focus on girls and we intend maybe to give HPV, they are in schools. So what does the school health policy say? So those are the things that we find that in terms of policies across sectors, we need to ensure that those policies are addressing the women's issues right from the time the children are in school so that they are empowered. Now, further to that, we have still faced challenges as a country in terms of having equipment, having technical knowledge by those who are serving, and issues of logistics that sometimes even come during when we have maybe a disaster or when we have, like we had flooding recently. So you find that women, especially those who are pregnant, end up suffering because they are not accessing the facilities and the services. The other issue is the distribution of commodities. We've tried that we reach every part of the country, but there are some commodities that they may not reach everybody. And therefore, that brings the issue of partnerships, and we really appreciate the partnerships that we are getting in terms of focusing on women's health. And most of the partnerships are coming around providing the services, making them better, building capacity for health workers. And this is being done by NGOs. And of course, the commodities that we distribute are brought in by the private sector. So we cannot work as government alone. These commodities that are required have to be, of high quality. They also have to be available all the time so that we can be able to give the services. Now, in terms of when we talk about the challenges that we face with the partnerships, there is sometimes a disjointed implementation that may occur when, for example, a new product is introduced and private sector may go ahead to engage communities, and government we find ourselves a bit following what is already being done. And the previous speakers just said it's good that we plan together, and therefore what lacks sometimes are joint plans, a plan that all partners focus on. As Ministry of Health, we do develop these plans every year, and we may need that every time we are making these plans, right from the beginning, we involve the various actors so that they are able to bring in what they have planned to do. The other issue is when it comes to resource allocation and management, Ministry of Health or government can have resources, but then other priorities come in, which make us not to use the resources as expected. And as I said earlier, the resources are never enough. And we are not able to deal with some of the disasters without having to disrupt the usual programs. But what I would say, in terms of what is required for women and the facilities that are required, the government has been working with the private sector. We have private facilities. We also have faith-based organizations that provide these services. And standardizing these services has been done through guidelines which have been developed. We have like the reproductive health policy, and these services are going on as expected. However, as the previous speaker said, we have issues that women face that are beyond Ministry of Health, that we need to look at how we can work with other sectors and also how to deal with these social issues. Now, the issues are many. For a woman to access a service that she may need, she may require resources, and therefore the issues of economic empowerment of women comes in. And therefore, we need to work together, private sector, NGOs, and government, to empower our women so that they are able to access the services when they need them. Further to that, we have also to empower these women to be able to deal with the challenges they face even at household level. As you know, some of the issues that we are dealing with, when we find that our young women, young girls are pregnant and they have to go through very unfriendly services sometimes, or they have gotten this pregnancy through rape or through other social issues that we find in families, we may now start thinking about how do we also bring in the issue of taking care of our young girls, and how do we empower them, how do we protect them, so that it's not just an issue of how we serve them when they are already pregnant. It's also how we deal with their issues when they are still young, and also being able to provide to them what they require, like sanitary pads. These are things that you'll find that we are trying to even issue sanitary pads through Ministry of Education, Ministry of Social Protection, but we could do this in a way that we are empowering these young people to be able to access these commodities whenever they need them, without having to feel like they have been made to sometimes miss the services because of logistics issues. So there are many challenges, and these challenges, and that's why I'm happy that we are talking about partnerships. The challenges can be dealt with, not just by one entity, but by all of us. And what I've brought out is the emphasis on developing common plans to deal with some of these pieces that are out of Ministry of Health, and also in terms of the services being provided together, so that when our women and young girls go to the facilities or to schools, wherever they need these services, they'll be able to get them without any problem. And we cannot forget that we have challenges with the climate change now, and therefore we need to be well prepared so that when we have too much rain, we ensure that the services are reaching the household level. And as government, we have the community health promoters that we are equipping and making strong to be able to help women with simple issues that they may need services on. So as we continue, we'll see that partnerships are really indeed important. Private sector comes in strongly, and also the NGOs that have to work with us. Thank you.
Thank you, Gladys. Obviously, important reminder that whenever you're doing it on behalf of the people, and government represents the people. You've also really brought about the whole of multi-sectoral collaboration. And I want to believe this too goes for government, the whole of government approach. I would also add the whole of society approach, but also reminding us about the needs of the woman through her life course. I mean, it varies a lot, it's very different, but being able to be responsive to that. And finally, obviously, the crisis that we face, whether it's climate, conflict, human-driven, whatever it is, being able to be there to respond during emergencies. I'm going to invite our next speaker for this round of questions. And our next speaker really is, again, an experienced individual representing multilateral agencies, UNFPA, Mr. Keegan Kipril, who is a behavioral scientist, having under his belt over 18 years experience in developmental programming and public policy. He has worked extensively in SRH, of adolescents and youth, human rights, governance, and child protection, and currently the sexual and reproductive health and rights and youth advisor at UNFPA Kenya, overseeing programs on maternal and newborn health, family planning, adolescent and youth, and also doubles as innovations lead and provides stewardship for the world's first adolescent and sexual reproductive health development impact bond program that UNFPA is leading. Prior to joining UNFPA, Keegan worked at the SRH and Rights Alliance, SRHA, has also worked for Chemonics International and the Center for Legal Empowerment, as well as World Vision. Keegan, as we continue in this conversation around partnership, UNFPA has been the front line in emphasizing the importance of, I would say, youth-responsive services in improving reproductive health outcomes. How do you see partnerships, across different players, government, NGOs, private sectors, and any other stakeholder that would, contribute to this? Ensure that the services are accessible and, of course, do not stigmatize, non-judgmental. They are available to this cohort of people that are important on this continent, like we've been saying, being the young continents. But obviously that these services are also centered on the young people that we want to serve across communities in Africa. So I would ask that we make our remarks short, just because we are running behind on time. And for all our participants, please remind to enter your comments and questions on the chat. So, Mr. Keegan, over to you. Thank you.
Thank you. Thank you very much, Dr. Gadari, for this opportunity. Really appreciating the leadership of the coalition in terms of convening this particular dialogue. Just to say that, UNFPA is the Sexual Reproductive Health and Rights Agency of the United Nations, and we normally serve to deliver a world where every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. Now, of course, when you talk about, responsiveness of services, looking at from the lens of, availability of the service itself, accessibility, of course, then, facilitating that uptake by the relevant constituency that we want to serve. Of course, there've been a number of issues, particularly when it comes to the barriers for the young people. And of course, this is really one of the biggest constituencies that we are talking about, not only in Kenya, but I think if you look at the demographics within Africa, particularly the sub-Saharan Africa region, you find that really the young people are really the biggest constituency. I think almost 75% of the population is basically below the age of 75, below the age of 35 years. So that also brings to the question that, of course, when you talk about equity, all the services that we are providing within the healthcare system ought to be responsive to the needs of this population. And over time, you notice that, there's been, notable concerns in terms of access to services by adolescents. The concept of youth friendliness, youth responsiveness of services has always been there. Now, this normally stems, of course, from the issues around provider biases. Of course, then we have a lot of cultural barriers that also come into play when it comes to, what is the society's perception of, adolescents, for example, accessing services. And incrementally, these barriers have always then predisposed the young people to, teen pregnancies, new HIV infections, and also really the lack of timely access to, services when it comes to GBV cases, which also predominantly affects this population. Now, if you look at the discourse that has been happening, I think not only in Kenya, but many other parts of Africa, is that there's been a lot of growing pushback. For example, when it comes to the issues of age of consent for access to services, and I'll give particularly to access to services such as contraception. And I think all of us agree here that we normally deal with a different constituency. Basically, the adolescents and young people are not a homogeneous population. You have those ones who are already married. Of course, we have legal legal remedies in terms of the age of marriage, for instance. But I think all of us understand that there are certain barriers which predispose young people to, early marriages. We also have adolescents who live in informal settlements, who experience poverty. That also predisposes them, for example, to transactional relationships. We've talked about period poverty and the implications of it, in terms of predisposing adolescents, particularly girls, to unintended pregnancy or teenage pregnancies, if you like. So all these populations, of course, we really have to look at it critically when you talk about introducing the age of consent, because then that, of course, then introduces barriers. We've looked at a number of policies that are coming up in most of the countries within the region, and all of these add to the barriers in young people's access to services. Of course, then the most important thing in this conversation, again, is about the agency of the girls, the agency of the boys, and really they're having that ability to make those decisions on when to access the services, them being able to make informed decisions about their sexual and reproductive health and rights. And that agency can only come, for instance, if, for example, we really prioritize issues of empowerment of sexual and reproductive health, issues of sexuality education. Again, there's a lot of pushback within the region in terms of when you talk about sexuality education, are we sexualizing children, or really we are providing them with the information to really be able to navigate adolescence, for example, which all of us appreciate, and all of us having gone through that stage, that it's one of those most challenging periods, really, that any young person growing up experiences a lot of peer pressure, experiences a lot of various factors within the environment, which really sometimes puts their decision making into test. And so really importantly is that what efforts are we be able to do to ensure that young people actually have access to that kind of education, not only within the education sector, not only within the health sector, even in the religious platforms, but most importantly, in the home setups. Are parents, for example, equipped to be able to provide this kind of information? So these are some of the barriers that keep on acting up. And I think also most importantly, when you talk about this constituency, because then by virtue of it, lying in various sectors, we really need to invest in the multi-sectoral response. And I think by that, I basically mean that when you look at the health sector, it has its own role to play. But needless to say, we can't really say that, for example, most of the issues affecting adolescents are health issues. I think it's really more or less of a lot of social issues that we really need to look at and tie to this population. And perhaps, for example, investments in the education sector, investment in the health sector, investments in the judicial system, because then law enforcement, for example, when you talk about sexual offenses, comes into play. A lot of lapses in terms of law offenses, sexual offenses. A lot of cases are handled traditionally using the informal justice systems, which really goes against the very, very, tenets of constitutionalism, because the sexual offenses have their own way of being that are supposed to be dealt with. Again, if you look at also the, within the home setup, I've mentioned the need to invest in parents, the community setup. All these factors really then call for, as we talk about the discourse today on partnership, it is really important then to look at that multi-sectorality of the issues at hand. And as I wind up, perhaps just buttressing the value of partnership, I think when you look at really the role of the digital space, we are looking at the way young people are able to mobilize and address issues. And I think these are some of the platforms that we can be able to really use in terms of bridging the gap, in terms of not only accessing information, but also accessing the services. At UNFPA, there is the program that we are calling the Development Impact Bond, which is a multi-partnership initiatives. We are catalyzing investments in the public and the private sector the private sector has a huge role to play, particularly when you talk about the dwindling resources. That we need to really be able to unlock other resources that are going to help us accelerate, tackling some of the gaps that are there. And lastly, of course, then when you talk about the value of partnerships in terms of knowledge management, being able to use this as a platform to really share knowledge of what works, what does not work. And also importantly for advocacy, which is what Angela actually has been trying to talk about. We can't continue working alone. We can't continue, segmenting populations the way they are. And for example, I just like, for example, the conversation that has been happening around the triple threat, looking at the intersection between HIV, GBV, teen pregnancies among young people. So if we continue to really try to look at a person as a whole, look at some of the vulnerabilities and respond to them holistically, I think that's the way we can be able to change the tide. Back to you, Dr.
Thank you, Keegan, so much. We'll come back to you. The triple threat, digital health solutions, partnerships, of course, and knowledge management. We are really running short on time, and we are going to enter another phase of questions, starting with Mokadi. And I'll ask that we make this really a rapid fire. And to you, Mokadi, how does Organon envision the future of partnerships in Africa to drive sustainable access to RH solutions? And what role do you see the private sector playing in advocacy and policy? Thank you. Over to you.
Thank you so much. And I think, the previous speakers have actually highlighted some of the key things that will lead to success. Because, for example, if we look at the integrated solutions, including digital platforms, it doesn't help if we have an incredible digital solution, but then the cost of data is too high for everyone in the country. Therefore, we need other so-called non-traditional stakeholders. So every single stakeholder, every single department would have to be part and parcel of the conversation when we look at how we can strengthen healthcare solutions. And now moving on to partnerships, we always say that, partnerships are really critical for the success of any solution. Because it's important that you have buy-in and ownership across the board. And to echo Angela's words, there's no help if we are coming up with a solution, but then the people that the solution is intended for are not part of the conversation. And this reminds me of a story where a company brought in tap water for the community who were actually getting water from the river. And they were surprised that nobody was actually using the tap water, only to find that actually women enjoyed their trip to the river because that was the only opportunity they had to have an engagement with other women to solve for some of the challenges that they face. Again, it's important to ensure that the solution, also in creation of the solution, includes those that the solution is meant for. Now, moving on to partnership, I think it's critical to ensure that, we are unified. And one of the Africa Union's pillars for success for Africa is around respectful partnerships. And this calls for different types of partnerships. So whether we're looking at a private company, partnering with another private company on a solution, we also need to look at private and public partnerships, which are probably one of the most prominent types of partnerships on the continent as well. And then there's also public and public partnerships, but there's a bigger call for us to expand this and have private, public, parent, and patient, or rather end user focused partnerships, because again, this will be a more integrated solution. So in my view, I would believe that we do need to look at the 4 Ps as we try and simplify this. So partnerships indeed are the new innovation, and there is a call for us to focus more on core or petition, which means collaboration instead of competition. And that is really going to be critical in ensuring that we can be successful in the space. And another key thing and this is mainly a call to government as well, that political will to ensure that as budgets are put together, there is specific budgets that are tailored for women's health solutions. I think it's critical to be intentional in the space. And one of the global targets around managing the country budgets is that at least 15% of the country's budget needs to be focused on healthcare. I don't think many countries are really close to achieving that target. I do know that Rwanda, it's been reported that it's one of those countries where actually they are able to put aside the 15% for health budget. But the bigger call is to ensure that within that budget, there is also an intentional budget ring-fenced to focus on women's health. And in the spirit of creating that equality, we first need to ensure that there's equity. So there might be a need in the short term to actually intentionally, disproportionately invest in women's health so that we can bring women's health onto almost the same platform as where we have healthcare across the board, just to ensure that we have that proper catch up between focus on women's health and the other aspects around health. And then another aspect that I would like to point out with regards to partnerships is that from a COWHA perspective, considering the fact that we are mindful of this siloed approach to health, and as the speakers before me have also mentioned that we have so many innovations on the continent. So one of the things that we are looking to do in the short term is to create a knowledge bank, and we encourage everyone to really upload their solutions there, where we have various solutions and partners that are operating on the continent towards a particular cause, so that we can start to drive for more engagements and partnerships as we're working towards the same goal. So if we know that an organization is actually working towards capacity building, for example, why not put those resources together, pull those resources together for a much greater impact? So we feel that one of the ways to start is to actually put together and make it easy for us to say, this is the information that we have, do the analytics, and then ensure that we can then have a more targeted approach where we can set clear targets and then ensure that we can monitor progress across that. And we have a lot of young people who can be involved in creating a solution like that. And there's also an importance of actually looking at leveraging some of the best practice examples from other low and middle income countries as well. And one that comes to mind is an initiative by the Asia Pacific Economic Cooperation, an initiative called Smart Families, which is a great example of partnership. And they have come up with a solution called Menu of Policy Options, which is a guiding document that actually addresses issues around how can we take that holistic approach to dealing with women's health. And so again, no need sometimes to reinvent the wheel, but one can look at other solutions that are available out there that can then be adapted to be solutions for the African continent and for the specific communities, as we have all hired and agree that we're not dealing with a homogeneous society, but then we can actually take some of the initiatives and actually try and customize them to suit the challenge that we are trying to resolve. But we cannot achieve that if we do not bring the necessary voices of those that the solutions are meant for to actually be part and parcel of that co-creation. Thank you so much.
Thank you, Mokadi, and thank you for reminding us about the Abuja Declaration that many governments on the continent have been unable to honor. Thank you for sharing with the successes of the Asia Pacific Economic Cooperation. And I think that's a lesson really for Africa, for us on the African continent to consider such an approach that can be able to help us across multiple countries. I'm going to move over to Angela. And Angela, of course, you did point out a few things, and you've had a couple of, I mean, the other speakers really alluding to that. I'm just wondering, given the diverse needs across rural and urban women, just across this continent, is to think through how can we effectively structure partnerships so that they are able to address equitable access. And and what about community engagement? Just having, I mean, you speak for the voiceless or the ones that are farthest behind. So just additional insights on how to go about this as we structure our partnerships. Over to you, Angela.
Thank you, Gathari. I'm not sure whether I'm still visible, I mean, not visible, but audible.
You are audible. Thank you.
I think those are good questions, and I like what Mukadi has said. I think some of these things we've already answered in our previous the previous questions. It's just to ask ourselves what has been missing, really, and not just asking ourselves, but it's also introspecting. I keep challenging all of us to a place of self-accountability. We've been in this space for quite some time, and we've at least I know most of the people in this panel have been in this space for quite some time, and even those who are listening and others, that do we get to a place, are we always on the move, trying to solve problems without looking at what are the usual and unusual lessons that we are learning? What are things that we need to drop, to stop doing? What have we been doing, but we need to start doing differently? And I think that the whole point about integration, but also collaboration, has come out very strongly. But most importantly, I think we need to ask ourselves, who are we doing it for? If we can be able to answer those questions and let those we are doing for, whatever we are doing, hold us to account and tell us. Sometimes it's not easy to be told. Feedback is very harsh and very hard a lot of times. But I think we're in a space now where we should be ready for feedback from the people who we provide the care to, or that we design products or policies for, and all that. A lot of times we are the judges and the jury. So we start by saying we design these programs, we do these policies, we do the reviews and everything, but we are the ones doing it. We need to take a pause and introspect, and maybe take a step back and let those we are doing it for come and give us feedback. Why has it not worked? Where has it worked? What do you need to stop doing, or what do we need to start doing, or completely discard completely? And I say this from the place of where these women are, because I happen to meet many of them in different African nations, but also in my country where I'm based a lot, where they keep on saying that for them, this is for this organization, this is for government, this is this. And at the end of the day, we have made them so apathetic to the reality that at the end of the day, they have the power. I am one person who, and White Ribbon Alliance generally, I don't like the word empowerment. Why I don't like it is because a lot of times we assume that the consumers of our care, or the users of the care, the real expert, as I keep telling you about, do not have the power. What we forget is that these women and girls, especially because of the patriarchal issues and the nature of our societies, but also the gender inequalities that have existed for quite a long time, these women and girls are born with power. It is the society, including you and me, that come in and take away that power, because we come from the place of we are giving you, you don't have. So we think for them, yet left alone, they do so much. When we go to these communities, we find that they're already existing. And so our narrative now is about igniting the intrinsic power that is with these communities towards their self-determination, self-reliance. And so our work is basically to catalyze whatever is already existing there. And so if we can start from a place of partnering with that mindset, introspecting critically, holding ourselves to account that we've done it, is not worked, or it has worked to this extent. What if we try different ways? I think we'll be able to go far. And when I say this, I say with a lot of respect to those who provide the resources, the donors. I'm glad that their partners here like JPIGO, UNAPA, that we've been working a lot around the issues, including Hoganon and the like, around the issues on women's health. If we can be able to introspect, sit together and see what are we hearing, and I'm glad that is changing. The ask, listen approach is really like coming into play to really change that narrative and the like. But most importantly, ask ourselves, why don't we drop the whole aspect about the projects and adapt to the changing times? Adapt to the technology innovation that is coming in. Adapt the fact that the agenda is not ours, it's the women and girls that we are really talking about. And it's the broader agenda that brings us together. And as I conclude, I think one of the things that we need to acknowledge, and I said this earlier, that you and me, at the end of the day, are here for the needs and to achieve better health outcomes for women and girls. They also want better health outcomes for them. So if that can be our starting point again, that all of us are here in a very non-antagonistic way, whether it is the governments, the private sector, the donors, the academia, the innovators, the women and girls, the users, and we come together and sit together and many more, and we curate something that is really long-lasting and sustainable, and that is driven by the people who are going to be there for quite a long time, the users of care, and us as the catalyst, then we are going to see much more. But if we continue doing business as usual, I can tell you we'll not go far. We'll continue keeping doing, but we don't see the resources we want to see them. They say that if you want to go far, if you want to go fast, you go alone. But if you want to go far, you go together. And I think for me, this is really critical at this moment in time. And I'm glad that COWHA has brought us together to see how this can actually happen in the African continent, because we have the poorest of outcomes, but we also have a lot of resources that we can be able to pull together instead of replicating, and we get where we want to go. Thank you, and back to you.
Thank you, Angela. I think you reminded us pertinent issues, and I think we are also serving a really very well-informed and bold segment of society. I mean, for those who are in Kenya, we know what is happening with the Gen Zs, and I think we are not insulated from really being accountable to them and being able to listen to them, as Angela has kept reminding us, and being able to work with them and being able to collaborate and not compete, like has been said. Gladys, we are coming to you, and the question really is around what successful PPPs have been to improve access, and this I'll link also this with a question from one of our participants, really, which is around if you can share about your ministry's experience in terms of supporting the private sector in engaging them in the health workforce, and also development, procurement, taxation, which the question comes from Abati from Ethiopia, and he says these are major challenges for them in Ethiopia. Perhaps if there are some insights you have that Ethiopia can learn from Kenya, I think that would also be very helpful. But really, the question is around successful partnership models that you have seen. Over to you, Gladys.
Thank you. First of all, I like what Angela said, that she didn't like the word empowerment, but she has thought as a new word, igniting power, which I think is what we embrace. And just before I talk about the successful partnerships, I think we have had the issue of participation of the communities. It's actually in our constitution, several articles, Article 10, Article 118, 201. They are actually pushing for public participation. But the issue is, when we go through these policies, do the public actually participate? And specifically, do women participate? But we know that if we are able to ignite this power, the women then will know what they need to do, and they will participate in whatever discussions we are having. So in terms of success stories, just the obvious one of them is family planning. Family planning in Kenya has been there for years. We've seen an increase in access to modern family planning services, which has improved from 39% 2014 to 58% in 2023. That is according to the Kenya Demographic Health Survey. So this is an intervention that is voluntary, and given that there are many other factors that can make women not even seek this service, their religious issues and all this, we've been able to improve in this. Now, We know that private sector has played a role in coming up with the products, the family planning methods that we are using. The government does not manufacture any of those. So they are given, I mean, they are manufactured by the private sector, and the government creates systems for that to be taken up. So we have strengthened our systems in terms of the distribution of the commodity, and that has been a success, as you've heard. That increase is not small. Then, of course, our maternity services, we are working together with private sector. We use also faith-based organizations, as I said earlier, to provide these services, and women are able to access them, and with high quality services, though we know there are still challenges. Now, in terms of what has worked, somebody's asking whether there is an example of where we've engaged private sector and it has worked. I would only actually talk about what I know of and I've participated personally. We've engaged private sector to change to improve the quality of food, especially the maize flour, the salt, and the oil by fortifying. And I think the process we've gone through that has helped us is that of understanding what their challenges are and providing the solution. Right from the standards for production, we need to have standards for everything, even for family planning commodities. And when they're being manufactured through the Kenya Bureau of Standards, they are able to make sure they meet the standard, or even when they are being imported. So through that project that we conducted on food fortification, we were able to go through that process. Sometimes you need training to be done, and the private sector will always take it up. The problem is monitoring. So monitoring after you have started the project is where it becomes a problem. But basically, we are saying that engagement of private sector in providing health services and ensuring quality is workable if our policies and laws are in place. And for Kenya, I think we have done a lot in terms of coming up with policies, laws that will make things mandatory. And there is good space for private sector to participate, except for issues of taxes, which I may not be able to comment on, but that is where we need to, link health and what others are doing, the economists, what they are saying. And that is what we are applying even in our health laws that have come up, the latest. We are working with the economists, looking at the financing of health, using the financial experts, and and also in bringing in private sector to show us how it can work better. The other thing I wanted to say about private sector, innovation. Innovation is stronger when it comes from private sector than from government. So these are areas that we really would like to see that we continue, talking and engaging further and sharing knowledge so that we are able to use it to improve the services that we are providing. Back to you.
Thank you, Gladys. And maybe Keegan, because you are coming up next, just wondering, Gladys has pointed out around innovation, and you also have this big background of being the innovative focal point for UNFP in Kenya. And I know you had initially started speaking to that. Maybe you can give us a little more detail into how you see innovative approaches being able to help, especially around the partnerships and, as we drive this continent forward, how you see, the opportunity that this presents to us. Over to you.
Yeah, thank you, Dr. Gadari. And indeed, actually, when you talk about partnership and innovation, it becomes a very critical cog, because then the essence actually of innovation is basically being able to do things unusually. We saw what COVID introduced in terms of dynamics of providing services. We had to really think outside the box, or really without that box, to ensure then that at least we are able to serve the population with the relevant services. Just maybe a few examples that I've seen happening. We've had a lot of partnerships, for example, with Philips, Safaricom on telemedicine. Really a critical concept in terms of really trying to ensure that some of the critical services that may not be available at the last mile can actually be availed with experts who perhaps may not really be closer to those facilities. So telemedicine is actually one of the great areas of innovation that we've seen made possible through some of the partnerships. Of course, the other one that perhaps I want to just talk about is the conversation, for example, around point of care ultrasound. There's really been a lot of emphasis around this conversation. The ministry, for example, in Kenya has already worked on the guidelines for the same. Perhaps it's going to really revolutionize maternal health care and really try to be able to deal with some of the some of the danger signs that perhaps can be handled in good time. So of course, that is, we've seen some action, for example, from Philips in collaboration with the Ministry of Health, coming up with some of these portable devices to be able to deal with some of these issues. I think a lot of interventions are out there in terms of E&M health, perhaps that can be able to really help in terms of accelerating, access to health care, particularly by women and girls. And this can only be made possible, for example, if we continue investing in the same. Because then if we don't invest in the same, we've seen a lot of things that young people can be able to do, for example, in terms of this innovation space. But then again, it's more or less like a gamble. Sometimes, when you put out, calls for innovations, some of them may not necessarily, be able to reach the scale that you may need to. But then ultimately, someone has to put their money into it. So we really have to really try out a lot of these solutions, try to invest in these solutions, but most importantly, also shifting from what we always continuously call pilotitis, and trying to pilot new novel initiatives, to actually trying to see how can we get to scale. How can we also then try to also make sure that as we come up with all these solutions, can they be able to speak to each other? So interoperability, connectiveness of some of these initiatives becomes very key. My takeaway perhaps is just to say that we can't continue operating as usual. We really have to invest in some of these innovations. We have to think of the partnerships that are going to help us to achieve this. And that cannot be the only way that we can be able to actually change the game when it comes to access to healthcare by women and girls in the region.
Thank you so much, Keegan. And we really want to make sure you leave enough time for questions. So we'll just ask each of the speakers, of course, starting with Mukadi, to sort of make their concluding remarks and think through what this, what next after this conversation? What should we be focusing on? What should we be thinking about, so that then we can be able to move together as one, and of course, being to support the governments and working jointly, collaborating, coordinating, not competing. Just thinking about that, so that we can allow, we have a good number of questions that we would want to address. Over to you, Mukadi.
Thank you so much, Dr. Gathari. Indeed, the conversation has been extremely rich. So one of the key things that we'll need to take out of this discussion today is to look at some of the key elements that came through, things around how do we continue to drive for partnership, how do we make that a lot more tangible, and how can we ensure that from an individual organization perspective, as the various organizations that are on this call, how do we ensure that we can progress more towards action rather than a lot of dialogue with very delayed action, if I can put it that way. So to your point, we do need to leapfrog into resolving these issues, and then take some of the lessons that we have made from, or we have learned from COVID-19, and then bring this on to say, how can we continue to advance women's health given the insights that we have? And then we need to interrogate some of the investments that are required. And in some instances, it would require shifts in how we've traditionally done things and challenge ourselves beyond the obvious. So it's actually now going to have to be business unusual, because we do have to take into account the changes that have happened in the environment in which we operate. So what are some of the policy shifts that are necessary? There has been a call out, for example, to ensure that across countries, there is a review of the age of consent for people to have access to health care on their own. So those are some of the policy shifts that would need to happen, but also continued advocacy to ensure that that intentional involvement of women and really reigniting their power to move forward and become more economically active and become a lot more involved in crafting these solutions can actually be driven effectively. So there might be a need as well to reshift and reprioritize some of the budgets and some of the key resource decisions that have to be made. And within the system itself, if we look at the different sectors, how can we come up with integrated solutions that are also aligned with the Agenda 63 as well as the SDGs, to ensure that the solutions are not siloed, but are a lot more focused on achieving the same goal? And how do we drive for working together rather than against each other in a competition space, considering that our key stakeholder at the end of the day is the woman and the girl, that we really want to ensure that the environment is supportive for them to fully thrive and to reach their full potential. Thank you.
Thank you, Mukadi. Angela? But if you don't have, closing remarks, it's good because you have questions too.
Thank you so much, Gathari. I think I'll just add a few things. One of them, I think we need to adapt a total mindset shift. I think a lot of times the thing that makes us not move is our mindset. Even when we say, when you hear the saying that the sky is the limit, for me, it's not the sky is the limit. It's actually our mindset. Once we have that mindset shift in terms of what is lacking and where do we need to go. And I think I'll tie that back to what I said earlier, what is not working, and be very intentional in that. The intentionality, I think, is what really matters. But I think at the same time, I think we also need to be very intentional in terms of who are the partners who are missing out. But before we can even think about that, we need to ask ourselves, what are the issues that we've been missing? Where is the missing link, really, a lot of times? And I think I see Mokadia said we need to change to think outside the box. A lot of times nowadays I tell people we should even throw away the box very far away so that it's not near where they are. Even if we are thinking outside the box, we should actually throw the box very far so that we start afresh building a new box if we need to build one. So that at the end of the day, we don't keep on crawling back to this box that we are so used to, because that's what we do all the time. So we need to be very intentional. We need to change our mindset and shift our thinking. But most importantly, we need to acknowledge again what I told you. What are we doing? Whose business are we doing it for? Whose business are we doing it for? If it's for the women and girls, then we need to let them be at the center of it all, not us taking the center and making them sit on the side. And as I conclude, I want to answer a question that I've seen here, which is around donors being the decision makers. They're the ones who push us to do this. I've actually, working in this space, I've realized that donors are people and policymakers are people. And so if we go from a place of making them see solutions, making them see why it needs to change to this, I know it's not easy as I am saying it, but once you start speaking slowly to slowly, they also start shifting and seeing your thinking. So I think it's also a place of starting slowly, but moving, knowing that at the end of the day, there will be a shift. But the shift has to start intrinsically with us and then extrinsically with the rest of the people. Thank you, and back to you, Gathari.
Thank you, Angela, for answering that question. A tough one, but thanks for handling it. Gladys, your concluding remarks?
Yeah, if I can just pick from where Angela's left and talk about the issue of donors. If there is proper coordination, bringing all the actors together, then it will help us to ensure that the resources that are with the donors are known, and we can be able to put the resources where their priorities. The other thing is this is a good platform. We've talked here. And as we've been talking, we need to look at how we engage women. We need to create structures that can engage women up to the lowest level so that they're able to bring out the issues that need to be dealt with and put in the policies. The other thing is we've talked about policy review, looking at policies across sectors to see how we can ensure women issues are also put in there and implementation is done. So even monitoring what is being done is something that we need to do. Advocacy comes in as key, that we need to keep advocating for inclusion of women issues in these policies and also in implementation. So I think I'm happy that we had this forum and we can keep talking, but more of implementation. As we remove the box, let us ensure that we are well coordinated. Thank you.
Thank you, Gladys. Keegan?
Yeah, thank you very much. I think just mine is to just say two things. One is around the need to really keep investing in securing political goodwill, because a lot of these indicators are where they are, because then somehow I think a lot of things are happening at the technical level, but do we really have the goodwill at the highest level in some of our countries to really change the tide on some of the indicators, be it maternal health, be it adolescent health, and all these issues that we really keep grappling with for over time. Number two is just to say that really the value of knowledge management. I think as a Christian, there's something sometimes we normally say that there's nothing new under the sun. There are certain things that have been there time and again. Sometimes we look for solutions that are pretty much new, but exactly that, not knowing that, of course, there are certain things which have worked over time, and perhaps you're not putting them into practice. So really, as we think of innovations also, but there are those things that are already there that are working. How can we invest in documenting the same, sharing the same, applying them, and also taking them to scale, not only in country, but also regionally? And lastly, we really need to keep on investing and in new partnerships, catalyzing new partnerships, consolidating the partnership that exists, but also trying to shift and really looking at the role of the private sector in all these conversations. Thank you.
Thank you, Keegan. And really want to apologize to our participants. You really ran out of time, but what you're going to do as COWHA with the Secretariat is to curate all your questions, work with the presenters, and be able to share this as we share the recording. I think we really won't be able to answer any questions live here just because the conversation has been so exciting, so rich. Unfortunately, we'll not be able. We don't have time to answer the question. And I'm actually quickly going to hand over to Caroline to close us out. Really appreciate and thank everyone for their active participation. Really, really, we appreciate this. And it shows there's need for us to continue with this. Over to you, Caroline.
Thank you so much, our able moderator, Dr. Gadari. That was really amazing and insightful. A big thank you to our panelists and a special thank you to Professor Julio. You stayed with us the whole time despite your busy schedule, and we truly, truly appreciate your presence. A bigger clap and thank you to the participants for your questions, for your comments. I think we've really enjoyed it, and we're going to make an effort as a secretariat to make sure that we get back to you. I think for me, just very quickly, because I just have 2 minutes, is just to say the thoughts that stood out for me. The AU said without each other, without each of our collective efforts, we cannot attain our goals in healthcare provision. Mogadi said, all of us to unite for her. Hence COWHA. It is why the Coalition of Women's Health was formed. There is nothing for us without us. When I looked at Madam Gladys, she said, innovation is stronger when it comes from private sector than from government. So for those of us who are sitting here from private sector, we are looking up to you as the women to innovate and to give us the solutions that will allow us to be able to meet our sexual reproductive health needs. Dr. Keegan, I really agree with you on this. Keep investing in securing the political goodwill. Without that political goodwill, all the amazing work that we could do might not be able to reach that woman, that girl that we are trying to reach. And Angela, I really love this, that users are the real experts. They should not be passive recipients of care, but rather architects of their own care. So on behalf of the Coalition of Women's Health in the Africa Health Business, I want to say a big thank you. We are going to make sure we respond to the questions, and this discussion will not stop here. The next series of webinars are coming up. We welcome you to be part of it, even as we plan more activities and go to the ground and make sure that we impact that woman, and that woman includes myself. So as I close it out, I want you to allow me to celebrate a very special woman today. The chair lady of COWHA is celebrating a birthday, and we thought, what a moment, what a day. Madam Chair, we celebrate you. It is a happy birthday. We hope that you have a fantastic day. As we agreed, make sure you get some wine, dress up, and go for a nice dinner. I want to thank everyone else who is with us, the team from AHB, and who would like some feedback. Please scan the QR code and give us some feedback of what you thought about our webinar, any insights, any thoughts. We would really be grateful. Otherwise, thank you so much. God bless you all. Looking forward to the next interaction.